Ultimately, getting those screening services that many of us all need, I think is very important to that patient's ongoing health.
It really starts with just asking that question. Let's make sure that we know the patient's tobacco use.
Welcome to MedAxiom HeartTalk, the podcast where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
I'm Melanie Lawson, a journalist in Jacksonville, Florida, and host of MedAxiom HeartTalk. Today's episode is the second in our new revenue recovery series. The goal of the series is to empower you, physicians, administrators, and revenue cycle managers to effectively communicate and ensure your organization does not leave any money on the table, especially if you're doing the work. In the second episode, we will discuss the importance of having a discussion with the patient or shared decision-making about getting a low-dose CT scan and some common challenges to capturing counseling for a low-dose CT scan. Then we, of course, as we always do, explore some practical tips and solutions as well. Today, we'll be discussing detailed coding guidelines. So we've added a cheat sheet to the episode notes to help guide you through the discussion, hoping to make your life just a little bit easier. So I'm thrilled to introduce today's guest. They are regulars on the show. First up, a familiar voice for Heart Talk listeners, we have Nicole Knight, Executive Vice President of Revenue Cycle Solutions and Care Transformation here at MedAxiom. Also, Linda Gates-Striby, MedAxiom Consultant and Revenue Cycle Solutions. Thank you all for joining me again.
Thank you, Melanie. Great to be here.
Yeah, happy to be here. Thanks.
All right. Well, if you don't know and you'd like to know a little more about their backgrounds, check out their full bios in the episode notes to learn more and to get in touch if you need to. So today we will skip that first question that we ask all Heart Talk guests because we do know your aha moment and how personal it truly is for both of you all. And it makes you so passionate about the work that you do. Remember, if you haven't listened to the first episode, this is our second in this revenue recovery series. Please go back and listen. Really good discussion on smoking and tobacco cessation and how to capture those dollars when you're doing the work. So Nicole and Linda, again, they do answer our first question, which is how they got into the business. And I think that it will inspire you as well. So Linda, let's start with you, kind of to set the stage. Which CPT codes are we referring to when we say counseling for low dose CT scan?
Well, it's a G code, alpha G0296. And this G code was actually designed for use by Medicare, but is accepted by a number of payers, including most of the commercials. Its full description is counseling visit to discuss the need for a low-dose CT cancer screening and kind of go through that, what makes a patient a good candidate, what makes them eligible for this, and then to have that discussion as to the benefits and share that decision-making between clinician and patient. So that's the code that we would use to represent the conversation. And what's really important when we build that is that we link it to the reason why we had that conversation. And there is a particular diagnosis code that is the one and only code that Medicare will reimburse for. And that's the Z87891. And what that stands for is personal history of nicotine dependence. Now, a lot of the commercial payers, they'll cover the codes for tobacco use and nicotine dependence. But when it comes to submitting the claim to Medicare, there is only one reimbursable diagnosis code. So it's important to use that particular code, the personal history of nicotine dependence.
Okay. So Nicole, let me ask you, what is the CMS reimbursement for these codes that we just talked about?
Yes, the reimbursement, like Linda mentioned, for that G0296 from Medicare is about $25. And the work RVUs related to that are 0.52. So when you're appending that applicable diagnosis code that Linda mentioned, that Z code, and you bill this to Medicare, that reimbursement will be around $25.
Okay, so definitely worth the work. Again, Linda, what are the requirements for capturing these codes?
Well, you need to document the fact that you are having this discussion. So the patient's eligibility, and that's what the part of what the clinician's being reimbursed for is looking at their smoking history and their signs and symptoms, and then having that discussion that really talks about why might they do this? What's the importance of it? How finding and diagnosing cancer potentially early can impact their comorbidities, and just seeing if that patient is willing then to undergo that treatment, and then also maintaining that counseling about smoking cessation if they are a current counselor. We talked about that in our previous episode, but you could do both. And that would be actually a really good thing to do if you found through your smoking and tobacco cessation that you do have a tobacco user, to then say, okay, have you ever had a low dose CT scan? And have the two just go hand in hand. And then you've added both services on top of the E&M. And it's a discussion you're already having for a total of a 0.76 in work RVUs. So it is distinct from your visit and your E&M code. So you'll need a 25 modifier, but it's just the nature of that conversation and that discussion with the patient that this code is representing.
Wow, you wonder how many of our physicians are missing this opportunity. Nicole, what should listeners know about coverage eligibility for the counseling for low-dose CT scan codes? I mean, we just learned one, how it kind of goes hand in hand with that tobacco cessation. What else would you say?
Well, for Medicare, the age of the patient has to be 50 to 77 years old. They're asymptomatic, and they have a tobacco smoking history of at least 20 pack years, which 20 pack years is 1 pack a year equals smoking 1 pack per day for 1 year, or 1 pack equals 20 cigarettes. So I found that pretty interesting, being a non-smoker on my end. Current smoking, or one who has quit smoking within the past year, and they have to have an order to get that lung cancer screening for that low dose CT scan. So that has to be ordered by a physician or advanced practitioner. It's covered 1 time per year, and your Medicare Part B deductible and co-insurance is also waived for Medicare. For commercial payer coverage, it does vary, and you should always confirm your patient's eligibility really based on their particular insurance carrier. Some of the differences are Medicare cuts it off at 77, and some commercial payers typically go to 80 years old.
All right. So learn about the codes, the requirements, and then eligibility. So let's take a pause here, digest some of that, and have a quick message for our HeartTalk listeners. You hear the term care transformation a lot, but what does it mean exactly? Care transformation is redefining the way consumers buy and use healthcare by developing new products, treatments, and business models that integrate separate healthcare organizations or activities. MedAxiom understands that moving the needle in CV care is not simple. It takes vision and leadership, and it requires bridging technology, innovation, and care delivery. MedAxiom experts are helping programs across the country shape the future of cardiovascular care delivery. Through education, organizational performance solutions, and advocacy, we are evolving disease management, innovating virtual care, driving the data revolution, and redefining access and team-based care. Let's transform cardiovascular care together. Get started at medaxiom.com/care transformation. Welcome back. We have been discussing revenue recovery with industry experts Nicole Knight and Linda Gates. Specifically for the second episode, how to appropriately capture counseling for a low-dose CT scan. So let's dive a little deeper into this. Nicole, just like we were talking about with smoking cessation and tobacco cessation, why is capturing counseling for a low-dose CT scan sometimes challenging?
Just like many of the other services that our providers are already providing, really operationalizing that and understanding that it starts with that order and that you're meeting all of the criteria can sometimes be challenging and overwhelming. And I think as we get into some implementation tips on how can you just simply have the discussion, follow a process to be able to capture this and not make it as challenging as all of it seems when you're reading what's required.
And once you get into practice, it just starts to roll off the tongue and it's a little bit easier. Linda, while our listeners may or may not, again, be the person literally coding the services, many listeners are the individual responsible for their program's overall success with revenue recovery. So what are your top implementation tips for counseling for low-dose CT scans?
It really starts with just asking that question. Let's make sure that we know the patient's tobacco use and what their status is. And if they are, someone who qualifies, meeting the age and the smoking, at least the history of smoking, to just have that thought there to say, oh, I wonder if they've had that low-dose CT scan. I will sheepishly admit I qualified for a scan myself. I am no longer smoking. And, the scans are maybe 15 seconds. You're in and out of there, 15 seconds. Now you've got the peace of mind that at least as of right now, I have no signs, no problems. But, one of the things that the clinicians that we can do to help them administratively is just building that template. In order to qualify for coverage, the entity that's going to perform the scan is going to need to be able to confirm that patient is actually eligible. So, that's going to include their date of birth and their pack per year history, their current smoking status, whether or not they're, symptomatic or asymptomatic at the time. So building that in the order so that you've had that conversation and have the physician just fill out the order and submit the order. And I know we get questions sometimes, well, what if the patient indicates at the time that they're receptive, they're willing, we place the order, so I bill the code, but they never follow through? Is that a problem? And it's not, because the clinician still had the discussion. They still, tried to share that decision making and encourage the patient to follow through. And if they ultimately did not, well, maybe they'll admit why when they come back the next time.
Right. Linda, congratulations. So glad to hear no longer smoking. And obviously this was a help for you as well as you were going through this journey. Nicole, and I think Linda makes it clear, within the MedAxiom HeartTalk community, we always bring our focus back to the patient. So how does appropriately capturing these services ultimately benefit the patient when it comes down to it?
Well, ultimately, getting those screening services that many of us all need, I think, is very important to that patient's ongoing health, and really capturing this for their payers and their insurance carriers to be able to know that they are getting the appropriate screening and care that they need ultimately impacts our patients. And I think just having that ongoing counseling in many of these areas helps with that patient getting reinforcement for either if it's stopping smoking or getting the screenings that they need. It's just that constant reminder.
No doubt. And I think anyone listening is going to benefit from this and think twice about some options that they have when it comes to revenue recovery. So thank you, Nicole. Linda, thank you so much for sharing your time and your expertise today on MedAxiom HeartTalk.
Thank you very much.
That is it for this episode. If you liked it, please tell your colleagues and let them know they can subscribe to MedAxiom HeartTalk on Apple, Google, or wherever they get their podcast. If you would like to send us a note or suggest a topic, you have an option. Just send us an email at hearttalk@medaxiom.com. We appreciate you. Thank you so much for listening.